This is Dr. Sanjeev, consultant orthopedic and joint replacement surgeon. Today we have a very interesting case of a 16-year-old male patient who had a polytrauma with very bad femur fracture with distal radius fractures, pelvis fractures, head injury and all, which we call it as polytrauma, 3 months back, for which he was operated elsewhere in other hospital. He came to us in a very tricky situation where he had, after the surgery, that is 3 months after the surgery, which was operated elsewhere in a different center, he came to us now with a trivial fall at home, with a significant amount of deformity in his left thigh, with excruciating pain, and he was brought to us in a very bad shape in an ambulance. The case is interested because he was already operated once for the fracture femur 3 months back with an implant, a rod inserted into the femur nail, which is a very common kind of treatment that we do in a day-to-day practice. But this case warrants our interest and becomes a very special case because of the condition in which the patient was brought to us. You can see this X-ray. This was the X-ray where the patient was brought to us. There is a rod that is inserted, and there is a fracture site at the midshaft of his left femur, which is not united and is a fresh fracture. So, with the rod inserted inside, there is a refracture along with the bent nail. The nail is bent so much so that the fracture is also given way and the bone is also re-injured. So this becomes a challenge. We have seen a lot of patients where the implant gets failed and the fracture will get refractured, the bone will get refractured, there will be non-union at the fracture site with a broken implant inside. Such kind of cases we have seen, couple of cases we have removed the broken implant, but this case becomes interesting because the nail appears to be straight, in the sense like appears to be unbroken with a bent inside. So this becomes a challenge for us as a surgeon from a surgical perspective to remove a bent nail from the fracture site. So what we did is we did not open the fracture site, which is itself by itself a challenge. So without opening the fracture site, we gently removed the nail. Unfortunately, I cannot show you the nail, bent nail at present. So we removed the bent nail and we did a surgery on his femur. We brought both the fracture fragments in alignment and we reinserted a slightly bigger, slightly better kind of nail, titanium nail, and this is how the fracture is looking after the treatment. So this is the bigger nail that we have inserted, and the fracture we have docked. We have done acute docking, and this part of the bones, that is extra bones that you can see, is a callus which we do not want to mess up with or touch. So this is how the X-ray looks like. So this case becomes a challenge and a tricky case because we do not want to open the fracture site and disturb the fracture anatomy as such. It was a mechanical failure, it was a failure of the implant, but without opening the fracture site, we have done a closed manipulation and reduction of the fracture. Along with that, we have done implant removal, bent nail removal in a closed manner itself without opening the fracture site, and we have redone the fracture and fixed with a better nail, and patient goes home happily.
நான் ஆல்ரெடி கோயம்புத்தூரில் வந்து ஆக்சிடென்ட் ஆனதுனால அங்கே ஒரு ஹாஸ்பிட்டலில் சர்ஜரி பண்ணியிருந்தேன். அந்த சர்ஜரி வந்து ஃபெயிலியர் ஆனதுனால இங்கே ஸ்பந்தனா ஹாஸ்பிட்டலில் வந்து நாங்கள் கன்சல்ட் பண்ணியிருந்தோம். அப்போ வந்து சஞ்சீவ் சாரும் வினய் சாரும் தான் வந்து சர்ஜரி பண்ணலாம்னு சொல்லியிருந்தாங்க. சர்ஜரி பண்ணதுக்கப்புறம் இப்போ நான் ஓகேவாக இருக்கேன். ஹாஸ்பிட்டல் சர்வீஸ் எல்லாமே சூப்பராக இருக்குது. ரூம்ஸ் எல்லாம் நீட் அண்ட் க்ளீனாக மெயின்டைன் பண்ணுறாங்க. தேங்க்யூ.